All right, good afternoon. Apologies for being 5 minutes late for the Honesty Hour today on Thursday. I have just run from a meeting to do this. Just run from a meeting with a local university, going back into my old roots of what I was doing previously, to build more of a network and connection to help the next generation of therapists come through and give them some training time, some mentorship, and help the next generation develop ultimately. So that was a very nice meeting to have with some colleagues that I can connect back with and catch up with. So that was really cool. But it went on a little bit longer than I thought it would, but it was a very good conversation. It's allowed us to think a little bit about the current situation of new graduates coming through and how they need some help to develop and support them and get to the level that is required to really help people, because I don't think that all the therapists in the world are able to do that and connect with people, and partly that's because their mentorship and their education only gets them so far, in my opinion, and it's actually down to somebody sitting down with them and helping them to develop, give them the skill sets that university can't give, and plugging the gaps of where they need to get to. So that was a really cool meeting, and it got me thinking, how many patients actually feel heard when they see a therapist who doesn't know how to truly communicate, who doesn't really know how to show empathy, or even educate a patient on what they're suffering with. Most of the time, I'm sure, because I hear this a lot, is that patients feel they've been talked over and kind of written off that they won't understand, so don't talk to them in a way that they will understand. When actually, if a therapist can talk about scientific topics in layman's terms, they're actually going to feel the patient can understand. The patient understands it more if it's put in a level that is suitable for them. So not talking scientifically, but talking at a level that the patient can understand. They're going to understand more. They're going to feel heard more. But it also, which the therapist doesn't realize, is if you can communicate something that is normally quite high level and scientific on a lower level for your clients and your patients, you actually really understand that topic. You really have a depth you have a grasp of the depth, and you have the deeper knowledge to be able to reword it so it makes sense to somebody else who's not as educated in that area as you, but also it allows that patient to feel heard and understood. So we've been working through how we can improve the communication of their graduates coming through so that they can show more empathy, people can be understood, and how can we help mentor that through placement opportunities within the clinic. So that was a really cool meeting. But we have a few things that I'm very excited about. At the beginning of next month, I go to Miami for 4 days to a business event that I've been invited to. So very excited for that, and we'll share more about that as the weeks, as we get closer and closer to that. And then at the end of April, beginning of May, I go to LA for a business event that I've also been invited to go to. So very excited on both of those fronts. I think it's going to be great, and I will bring back whatever lessons or topics I pick up. So very cool, a lot going on. We're very busy in the clinics, helping a lot of people, which is amazing. Just going to plug this in, otherwise I'm going to lose charge. There we go. Make sure I don't lose that. There we go, just turn it around. It's on me. There we go. Cool. But I have a few topics to discuss today. I am in the car after that meeting, so bear with, apologies. But there's some big things that have come through from questions that have either been in the clinic this week or over Instagram. So, and Facebook. One of the questions was, I was on the phone to at the time, potential client who's now going to see me tomorrow, funnily enough. She was suffering and is suffering with hip pain. She's been suffering for a long period of time. It's technically, as I lose my camera, Let's start that bit again. So I was talking to a patient that was suffering with I'm just gonna where is that going? There, perfect. So I was talking to a patient on the phone who has been suffering with hip pain for a very, very long time and has been pushed around the houses, a bit like I was with my knee. So when I had my knee diagnosis at 13, nobody wanted to touch me. Nobody wanted to, ultimately, looking back on it, ruin a 13-year-old's dancing career, international dancer. Nobody wanted to operate, nobody wanted to do anything. So I actually saw 3 consultants, my GP, another GP. I saw about 5 or 6 people on this journey, 3 or 4 physios. And this lady had a very similar ordeal. She had seen a couple of different consultants. She got recommended to have a steroid injection. Firstly, it was a non-guided, and then she was like, no, I want an ultrasound guided. So they ended up doing that. And she has hip bursitis and gluteal tendinopathy. I apologized to her for the fact that she had to have a steroid injection. Now, for context, she's seeing me for her hip pain that she's had this injection for that was non-successful. She had the injection in November. She had a pain reduction. It didn't completely go. A pain reduction that lasted for 2 months. And now she's back in pain more so than she was pre-injection. So to me, that's a real failure from the system, and it's a it's a poor success rate. She has not seen the improvements that they said she would be getting. Now, I know that medicine is not a one-size-fits-all model and not everything works for everybody. However, I think with steroids and steroid injections, they are missold as the golden bullet, and I think that they are overprescribed. A bit like medication, they are overprescribed. Now, if I was to tell you that they have a success rate of 50%, for me that's like throwing stuff at the wall and hoping it sticks. They also class 15 minutes of relief as a successful outcome for steroid injections. But they also have a risk of making things worse because you are putting a sharp object into something that's already inflamed. After my second injection, I couldn't walk for a month. I was worse off. I walked in pain. I came out in crutches after having a steroid injection. They're 2 of the most painful things in my life. I will never go anywhere near one again. And I apologise to this lady that she had to experience some of that. Admittedly, yes, she did get an improvement in her pain levels, but it wasn't completely gone. And now she's worse off for it. And I could really relate to her with the journey that I've been on and where she's at now. And I think that a lot of people are having steroid injections and being told that these are the golden bullet. What they are actually designed to do is mask your pain by turning off your pain receptors. So at a cellular level, you have nerves, and every nerve will have some form of receptor to it. In this case, it's a pain receptor. And the steroid injection is meant to bind to that pain receptor and turn itself off so that you don't feel the pain anymore. The problem with that is you're just masking the issue. Nothing has really changed at cellular level to make a quantifiable difference from a tissue structure that can tolerate more load or do what you're asking it to do. And what is meant to happen is you're meant to then do the right exercises and rehab, hands-on treatment, whatever it might be, to build up the strength around it so that when the injection wears off, you're not in pain anymore. But that's not ever done. It's not told to you to be done. It's, okay, you've had your injection, you should be good now, which is not helping anybody and actually is making the situation worse because you then go do loads of things because you're now pain-free, but your body hasn't built up the ability to tolerate it, and therefore it's more painful than it was before you had your injection. So we are now going down a route with her where it's hands-on treatment, shockwave therapy, the right exercises and advice to strengthen her up and go through a rehab plan, which starts tomorrow. And was the injection needless? No. Was it the right course of action for her? I don't believe so. Is there a time and place for injections? Yes, I'm not denying that. But I think they are over-prescribed and over recommended. Let's put it that way. Right. Question number... Tell my indicator off. Question number 2 that has come in is... It's not really a question, but I've reworded it because it was a question that comes across more this way. The old person stigma, loss of dignity and identity. We see a lot of patients that are over 50. We see a lot of patients that are over 65, and they want to be active so they don't lose their identity. They can still do the things that they love and enjoy. They are still treated the same by the people around them, and I think that's the biggest one. If you look at the post that I posted recently about my granddad's 87th birthday, if you read the caption there, I talk about other people doing stuff for the elderly population from a place of love, purely from a place of love. But actually what it's doing is it's taking away purpose and independence from them, slowly, subtly, but surely that's happening. So in that example, I used to go play golf with him, walk 18 holes of golf course. I used to take his golf clubs out the car for him. I'd be like, I'll do that for you, Granddad, make your life a bit easier in my head. But actually, he's already lifted it in there. He's walked the golf course. He uses that as his strength and exercise, but I'm taking that away from him. So slowly I'm taking away his independence and purpose. And I look at it and I look at, if somebody was to say to you, you go to your elderly parents' house or elderly grandparents' house, and they say to you, we'd like a cup of tea. And you go, yes, I'll do it. Don't worry. Sit down. I'll make it. You don't have to get up. Actually, if they want to, hence why they've asked you, and they use that as good mobility, getting up out of a chair, good balance, walking across the room, good coordination, having to do the hand-eye to do the kettle, hold on to the teacup and bring it back to you while walking. That is actually maintaining people's independence more than you know. And they feel purpose because they're helping you, they're doing something for you, and they still have their sense of identity. Where if we keep doing stuff for them, we're stripping that away and we don't notice it, but we're actually doing them more of a disservice and not helping them to stay active, mobile, and we want to make their lives easier, but in that moment, is making their life easier better for them longer term? I don't believe so. And I'm not saying I don't do things for other people. I definitely still do that. But I pick and choose when I need to do it and what's best for them as an individual, if I'm honest. And I don't want to see people struggle. That's not what I'm saying. I'm saying that if we strip everything away, that person's got no purpose to be doing anything or identity behind them. It's all from a place of love. I know that. But actually, it's taking away them as an individual. And sometimes we see it that clients will come in and they want to be seen. And what I mean by that is they're not seen in the same light by their family members anymore because they can't do the things that they used to do. But that person is still in there. That person from 20 years ago is still in there, wanting to be seen and recognised. And even so, with my granddad, for example, there's little signs of that. He has Alzheimer's, early onset of Alzheimer's, early stages of Alzheimer's, sorry. And little signs of him still in there. So we have a video of him recently playing the piano. He's never been taught to play the piano. He was self-taught, but you can see he is still in there because that is what he liked to do and enjoyed doing. Sometimes what we need to do is get him to do more of things to actually pull that person back out, and we see more and more of that individual rather than doing more and more for them and taking it away. So that hopefully is kind of hit home for some people who look after elderly parents or grandparents or whatever that might be. And I think there's a lesson there to say, if somebody says, I'll do that for you, say, no, I will do it. I can do it. And I want to still do it. I think that's big. Right, the third and final one that we are going to talk about today is, it kind of follows on to that in a way of, why does my health feel like a full-time job as I'm getting older? Part of that's a very deep question, and I don't know all the circumstances, so I will try and take this. I'm going to put a bit of context to this that I can speak about. So I don't know the ins and outs of all of this, but yes, things change as you get older. There's stuff like sarcopenia, where your muscles start to degrade in terms of their muscle quality, and part of that is because we do less exercise as we get older. We don't do as much resistive training. We don't eat the protein and food intake that we need to eat. If anything, it needs to go up, not down, and as we age, it tends to go down. Part of why it feels like a full-time job is because, unfortunately, the investment into your health through doing exercise, nutrition, movement may not have been there in the 5 to 10 years previous. However, it might feel like a full-time job right now. In 5 to 10 years' time, if you do what you're doing now, where will you be? That's what I would say. So it's a very interesting one of, it might feel like a full-time job right now, but it won't do in the future. And the kind of bit to that is, if you don't do it now, where will you be in the future? If you're already on the decline and you're still doing the same things in 5 to 10 years' time, you're going to be even further on the decline, if you see where I'm going with that. So my point I would say is, where are you now and where do you want to be? What does it look like?
America, because that was my dream as a kid. And when I went to UCLA, I stayed in...
Where are you now and where do you need to be? And where are you now and where do you want to be in 5 years' time, 12 months' time, wherever that might be? What are you doing today to help you get there? Or more importantly, what are you doing today that won't get you there? And thirdly, what do you need to start doing today to get there? That's the questions that I would put out there. Yes, it might feel like a full-time job right now. It will get easier the more you do, the more consistent you get, and the more disciplined you become over doing the things that are going to change the quality of your health, and investing in your health physically with the energy, exercise, nutrition, doing everything that you possibly can within your means to improve your health. If you do that and you stay consistent at doing that, the quality of your health will change in the next 6, 12, 18 months, 5 years, will be completely different to where you are now. So the questions I would ask are, what are you doing now that's going to benefit you in 5 years' time? What aren't you doing right now that you need to start doing to benefit you in 5 years' time? Right, that's going to be the end of this Honesty Hour. I now get to go and look after my kids and take my son swimming to a swim lesson this afternoon, which I'm very much looking forward to because I've been away for the last 2 weeks to be able to do that. And then we'll be back on Monday. Monday will be at 2 o'clock again. And we'll see what questions come in for that one. Have a lovely weekend. Long weekend for some people. I'll see you on Monday.